Good afternoon. It's great to see you all. I'm Janet Wall, CEO of both the Virginia Nurses Association and the Virginia Nurses Foundation. Having a little bit of technical difficulty here, so I can talk to you, but I can't put my camera on. But it is great to see you all. Thanks for joining us today as we focus on health equity in the midst of the pandemic. This is the final webinar of our COVID virtual series intended to support nurses as they navigate the pandemic. Each of our previous webinars can be found within our on-demand library at virginianurses.com, where they're free to all nurses throughout the Commonwealth. We will also be recording today's webinar, and it too will be available via our on-demand resource library. Nurses can receive 1 nursing contact hour for participating in today's event and completing the brief evaluation. The Virginia Nurses Association is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. There are no conflicts of interest for any individuals in a position to control the content of this educational activity. Registered participants will receive an email with the CE survey link following today's presentation. I also want to let you know that we will open the chat for your questions following the presentation. And now I'd like to introduce the chair of our joint foundation and association, Diversity, Equity, and Inclusion Council, Dr. Viveen Pierce McDaniel. Viveen also serves on the foundation's board of trustees as our diversity ambassador. Viveen?
Thank you, Janet. We are so pleased to have Dr. Janice Underwood, Chief Diversity, Equity, and Inclusion Officer for the Commonwealth of Virginia here with us today. Dr. Janice Underwood was appointed by Governor Ralph Northam as the Commonwealth of Virginia's first cabinet-level diversity officer. In fact, this position is the first of its kind in the nation. In this position, she is committed to addressing racial, ethnic, disability, gender-based, and other cultural inequities, informal and informal policies and practices in Virginia state government. As a result, Dr. Underwood is working tirelessly to build the One Virginia statewide strategic plan for inclusive excellence across more than 100 state agencies and with other public and private sectors. In her short tenure, she has been named one of 20 Women of Change in 2020 by the Virginia Museum of History and Culture for the accomplishments and impacts she has already had on the Commonwealth. Her goal to make Virginia an exemplar for the nation regarding diversity, equity, and inclusive excellence. Prior to her appointment, Dr. Underwood served as Old Dominion University's Director of Diversity Initiatives and as the chair of the President's Task Force on Inclusive Excellence. I present Dr. Janice Underwood.
Thank you so much for that kind introduction, and thank you for having me with you all here today. I was invited to talk a little bit about the efforts, the position, and some of the accomplishments and initiatives that my office and the administration have had, not only over the last year, but over the last 6 months in particular with the COVID-19 crisis. And so today I'd just like to have a conversation, and I'm looking forward to your questions and really linking arms with you all as the Virginia Nurses Association to really think about more strategically about how we can move the needle in DE&I, and even I would say DEIJ, and J stands for justice, initiatives going forward. How do we move the needle in transformative ways as opposed to what I often call check the box kind of ways? So as was mentioned, Governor Northam did appoint me to be the nation's first Chief Diversity Officer or cabinet level Chief Diversity Officer. As many of you all have seen in the news, there's a lot of racial reckoning going on these days, and oftentimes, even before all the protests that we've seen nationally, in our state and globally even, there's been this push to just say, let's hire a chief diversity officer. It'll make our organization better. But we know that that's not the case. There are good ways and destructive ways to do this work. And it's my intention to be on the side of the fence of the good, productive, meaningful, transformative ways to do this work, as opposed to, like I said, the check the box kind of ways. So I just like to have this conversation. I realize I'm in the comfort of my own home and my own office when I'm in Richmond, but I also know that everyone can't be. And in particular, nurses, you all are on the front lines and putting your lives at risk every day. And so I honor you for that. I honor your field and the medical field more broadly for all the work they're doing during this global pandemic. So thank you to all the leadership of the association and the field in general. And for that reason, as much as I can, and I'm allowed to, whether it be my schedule and or just the confines of my position, every chance I get to be part of a testing event, a community-free testing event, going door to door, providing PPE to the neighborhoods that need it the most. And I'll talk a little bit about that in a little bit. That's exactly what I do. I don't want to be stuck in an office or at home. I want to be out and making sure that the people who need it most get the help that they need. And to me, that's what equity is. So I'm just going to jump right in and just have a conversation, if that's okay. So over the past 6 months, the words contact tracing, social distancing, coronavirus testing, COVID-19, these were all once nebulous phrases, now familiar and used in all of our everyday conversations around the globe. As we listen to daily updates week after week, and well into this summer, we're going into the fall now, Virginians and people across our nation have witnessed, talked about, labored about the recognition of COVID-19's disproportionate impact on communities of color and those in economic distress. But as we were all, as governors across the nation, we're all fighting and competing against each other over PPE and testing kits, reagents, there came a much needed affirmation. And this affirmation actually came at the federal level. At the federal level, I want to say it might have been in April or May, I can't remember. Dr. Anthony Fauci, as you know, the director of the National Institute of Allergy and Infectious Diseases, confirmed that institutional racism, he actually didn't say institutional racism, but he just said racism was a contributing factor to the severe impact the virus has had on Black and Latino communities. And once he made that statement, it was like the press and the media and everyone's attention almost instantaneously turned to this disproportionate impact, almost in a trendy way that was a little insulting to me, because the disproportionate impact had been occurring and had been in plain sight for weeks, if not months. And while this national acknowledgement highlighted the intersection of racism and a disproportionate impact of the COVID-19 pandemic as two parallel inequities, only one would affectionately receive the title of public health crisis. So what am I saying here? I recently wrote an op-ed that institutional structural racism is endemic. It is the public health crisis that has killed more Black and Brown and Indigenous communities far more than COVID-19. That's a difficult truth for us to wrap our minds around, because then what do we do about it? For generations, people of color and their allies, maybe some of you, have put forth valiant efforts and even died in many cases. I mean, I think about the people that have come before me, whose shoulders I stand on, right? That have died seeking equality in the eyes of the public and the law. It's one thing to say this is the law, but we know that there's a a culture of just allowing systemic racism to just be emboldened. So we've stood up, we've marched, we've bowed our heads and raised our fists. And just recently, we've linked arms or elbows, right? And took a knee even. And yet we still see Black men and boys are still 2.5 times more likely to be killed than their white peers. And today, communities across the nation rally their cries in recognition of lives lost due to an underlying condition, an underlying health condition. I call that endemic institutional structural racism. One more even more deadly than COVID-19, and has been left undiagnosed for more than 401 years. And I was on a Zoom call last night with the Hampton NAACP with Galen Knoyton, and we were talking about the 15-year anniversary of Katrina. And we're trying to look at the intersection between the COVID-19 crisis and hurricane season, particularly in the Hampton Roads area, so that we don't have another Katrina ever again, and in part in Virginia. And she said, she made the statement that stuck with me all night, and I labored over it and I thought about it all night. And she said, we've been given kibbles and bits and bits and bits for the last 401 years. And it's time that we stop, just chomping at this little bit. When do we actually seek justice? When do we get justice? And so for that reason, I can tell you that since my appointment, we've created the Health Equity Task Force. And this is a group of interagency leaders that include those from the Office of Health Equity at the Virginia Department of Health, under the leadership of Sable K. Nelson Dyer, as well as Curtis Brown, the state coordinator or director of the Virginia Department of Emergency Management. Dr. Lauren Powell, she is an equity expert who is embedded in the Virginia Department of Emergency Management, who also is working there part-time, but in her full-time job is the executive director of Time's Up Healthcare. In addition to Alacia Hackett, who's the diversity and inclusion consultant for the Department of Human Resource Management. And we're all working together to try to really think about how do we provide leadership to a larger health equity working group, the first of its kind in Virginia state history, the first of its kind to exist during a state declaration of emergency, and part of a unified command through the Virginia Department of Emergency Management. And how do we guide equity through this recovery and response, and do it in ways that are transformative and justice-minded, and make sure that people survive this? We know that there are going to be generational effects. Even with schools being closed, we saw what those effects were during massive resistance in relation to the 1964 Civil Rights Act. So what do we do? Where are we? Right now we're having some very tough conversations. And these are the conversations that I'm hoping that you all are having, and it sounds like you all are having. But I think it's important for us to level set together for a minute. The Commonwealth was the birthplace for American slavery. Let's think about that for a minute, because many of you all consumed the 1619 project and initiatives of last year as residents of Virginia, as well as nationally. You know, that's deep for me, because it's not lost on me that as I stand on the steps of the Capitol, like not right now, but when I do, I'm walking into that building understanding that the second governor of Virginia, who wrote these founding documents, who designed the architecture of the Capitol and of University of Virginia, for example, only were able to do so using enslaved labor, enslaved skilled labor, and in large part instilled or institutionalized American slavery and built it into the fabric of our state and our nation. But the 73rd governor has appointed me to reckon with it and to help the administration reckon with this. That's not lost on me. So I just want to level set that while all of this served as a catalyst for what I call intergenerational trauma and a post-traumatic slave syndrome for Black, Brown, and Indigenous people, we know that laws and policies, including Jim Crow, slave codes, and vagrancy laws reinforced, oppressed, expanded the legacy of trauma in these communities, in my community, maybe your community, on a local and national level. Still yet, we see that this trauma actively remains through systemic and structural endemic racism, which is perpetuated by biased laws and the way in which our systems intentionally, actively, and can I just say illegally oppress people of color? But many people still refuse to reconcile with these truths, much less do anything about them. But why is that? I say that racism, which makes the disproportionate impact of COVID-19, this public health emergency, this global pandemic, even possible and more deadly for Black, Brown, and Indigenous communities, the reason why is because of racism. We can't quite put our finger on it, but we know it exists. We can't measure it, so we can't quite quantify it and or describe it. And if anybody does try to do that, for example, I know I'm trying to do that, we're viewed as the angry Black woman, or, Dr. Underwood, you're always talking about race and racism, and, I'm afraid to talk around you because I think you're going to call me a racist if I say the wrong thing or I ask a question that suggests I don't know everything. And I just say we've got to get past this idea that being uncomfortable is a bad thing. It's time that we be uncomfortable. In 2007, the Commonwealth of Virginia, and many of you may already know this, formally apologized for American slavery. So that came from the General Assembly at that time. So take yourself back to 2007, which only feels like 10 minutes ago, but the General Assembly formally apologized for American slavery. So what? What happened? What would we do about that? Later, in 2019, Virginia acknowledged, as I mentioned earlier, the 400th year anniversary or commemoration of the arrival of the first 20 and odd enslaved Africans to Old Point Comfort, which is now, as many of you know, Fort Monroe in Hampton, Virginia. So fast forward to 2020, what have we done about what's happened in 2019? Since then, and in its own ways, I will just share with you, the Northam administration has also been on a journey toward truth and reconciliation by advancing historic new laws which gave localities control over Confederate war memorials. We removed discriminatory language from the Acts of Assembly. And we created a commission to study slavery in Virginia and subsequent cultural and economic discrimination. Together, Virginia policymakers and legislators have also championed racial reconciliation by establishing Juneteenth as a paid state holiday, which many people say, well, why did you do that? Again, trying to start this conversation. Some people didn't even know what Juneteenth was. But we've also done other tangible things like expanding access to the ballot box, which could not be more timely, right? We want to make sure more people get a chance to vote by allowing early voting without a stated excuse, and the elimination of Lee Jackson Day in favor of making Election Day a state holiday. We've signed into law, Governor Northam has signed into law a historic equity agenda, which included making a chief diversity officer position, such as myself, a permanent cabinet level position for every future administration. So this is just a handful of things that we've done in the administration since 2019. And there's so much more to do. But I say all this because previous seeds of hope have now grown into trees of change with roots of reform deeply embedded into our systems, to likewise confront the deeply rooted institutional racism that has also been embedded into our systems. So in 2020, the Commonwealth of Virginia has taken the lead to serve as a case study, and I like to call us a national exemplar for the rest of the country to follow in order to reconcile with these complicated issues and enact change. But I know there's so much more work to be done. I'm not naive to that, but we're really starting to move the needle forward in transformative and justice-minded ways. So why is that important? Because it's not time to pat ourselves on the back. We're in the middle of a global pandemic. But on the other hand, we also need a little bit of encouragement, because people in my position have been given a bad name. Hey, just hire a chief diversity officer and it'll all be better. And that's not the case. That's a check the box kind of initiative. But we need to know and see tangible evidence of moving forward in the right direction. So while research proves that racial trauma and weathering, which, as I'm sure you all know, is the stressful and aversive a physiological and psychological impact caused by racism and discrimination, can have a disparate effect on one's social determinants of health, I suggest there's an antidote. And I suggest those are the individual and national reconciliation. So for example, right now we're kind of having a real talk, individual kind of conversation where we're talking about what can the Virginia Association of Nurses do? What can you do in your own sphere of influence? But we also need to have a national reckoning. Like, who's going to lead us into this national reconciliation? Why don't more states have a cabinet level chief diversity officer that can then create a coalition of allies outside of Virginia, where I can reach out and touch or elbow people in other states so that we can interrupt systems of inequity? Could there possibly be a national or federal diversity officer that really helps to bring our nation together? We're so divided and tribal, and we're thinking the worst of everyone. What do we have in common? What are the ties that bind us? And I would suggest those are humanity ties. And if nothing else, this COVID-19 global pandemic crisis, public health emergency has shown us that. It's only unearthed all that we already knew was broken. So I'm also going to challenge many of you to stop saying our systems are broken. Stop saying the healthcare system is broken, because I know you see the problems. It's not broken, my friend. It was built that way on purpose, intentionally, illegally, so that it could inconsistently help those that it never intended to help in the first place. Of course, there'll be some exemplars, but on a whole, looking at it from a macro sense, all of our systems, our healthcare system, our education system, our banking system, our housing system, our criminal justice and law enforcement systems, all of our systems have been built inequitably on purpose, because our country was founded upon principles that were very discriminatory in the first place, that were only intended for white men to succeed and have power. So if that's the case, and every instance of our actual forming as a country has been those who were not in that group of white men reaching out and demanding shared power, and basically asking those white men in power, share some of your power with me, and then them acquiescing in some cases and in some cases not. Tell me how that's not our country founded and built upon racism. I mean, these are just hashtag facts. These are facts that are difficult to hear. They're facts that are difficult to reckon, but it's not that I'm asking anybody to reckon with facts. I'm saying, what are we going to do about it? How do we come together and have a conversation to make the changes that make opportunity accessible to everyone, as opposed to a small inner few at the table of power? So I will tell you that I daily witness Virginians and their ability to persevere to fill in the gaps in our systems, especially our public health systems, in response to the needs that, as I shared earlier, we already knew were pre-existing, but are now more widely accepted as urgent. For example, we talk about our frontline workers as being essential. Also, now they're essential. They're the backbones of our society, but now they're essential. And so what are we doing to help these essential workers across all these different sectors, including the healthcare sector? What are we doing to protect them? What are we doing to honor them? And what are we doing to advance them and their families? Because they're making sacrifices for all of us. You and I, everyone on this Zoom call, all of your friends in your neighborhood and your spheres of influence, you and I and Virginia as a whole are poised right now, are so uniquely poised to reckon with our history and leverage structural change to provide the much needed medicine and treatment our state and nation needs for genuine healing and restoration and reconciliation. Last week, or the week of August 6th, the governor formally acknowledged Racial Truth and Reconciliation Week. We held Governor Northam's Town Hall for Racial Equity and Law Enforcement Reform to really start this discussion, not just on law enforcement, but racial equity more broadly, and talk about what are the necessary reforms that we need to survive this global pandemic, this COVID-19 public health emergency. And how do we also reckon with the racial inequity that makes unfair policing even a thing? What are the historical antecedents, for example, that perpetuate unfair policing of Black and Brown and Indigenous communities, or the colonization of Black and Brown and Indigenous communities from the first moment we stepped foot, the first immigrants from Europe stepped foot on our nation's soil. And right now we're in special session, and the General Assembly and all of our policymakers are reckoning with things like our budget. And what do we do now that we're in the middle of this COVID-19 crisis? What do we do now to reckon with racial inequity in parallel ways, right? We have still the regular January 2021 session as well. And we are setting the standards for racial reconciliation and an anti-racist reform across all other dimensions of diversity. So before I go any further and we move into questions, I want us to resist what I call discrimination Olympics. So I'm not here to say or to compare my oppression with your oppression, or this type of oppression with another type of oppression. That's not what I'm here for. My job is not to figure out who's been more oppressed than the other. Instead, I'm encouraging all of us to take up our tools of influence and till the seeds of hope for humanity, especially those of color, where there's an intersectionality of so many different dimensions of diversity. So my job is to bring us together and fight for humanity, and fight for those policies, and that formal and informal, and those pieces of legislation that will begin to turn us towards a more inclusive state. And I just also like to end with, in the spirit of civil rights activists and leaders that came before us, and many are coming to your mind, I'm sure, right now, most recently, John Lewis. I charge each of us, you and me, to roll up our sleeves to further advance Virginia's historic racial equity agenda, so that we can get closer to realizing our part in creating a more perfect union. And who knows, perhaps our trees of change will soon be a forest of freedom, of true and genuine freedom. So thank you so much. I'd like to talk with you more about what we're doing in the Commonwealth of Virginia and the Health Equity Working Group. I'd also like to make a plug that there are ways that you can get involved, and I will be sending some of those to your leadership, that will send them out to you, of different volunteer positions, working group positions. There's, for example, not only the Health Equity Working Group, but also there's a vaccination working group and a vaccination advisory group, where we need your voices, we need your influence, and we need your expertise to guide the Commonwealth, in particular, the Virginia Department of Health, to get us closer to surviving this pandemic. So thank you so much. I'll turn it back over to you. Thank you.
Thank you so much for that insightful presentation, Dr. Underwood. As Janet mentioned at the onset, we received a number of questions from nurses at the time that they registered for today's webinar. So I'd like to pose some of those questions to you now. We will also take questions from everyone listening in today. So please begin typing your questions and comments in the chat box. So the first question is, in communities where there is a lack of trust of the local healthcare system, how can healthcare providers best promote wellness and COVID prevention?
So that's a really great question. I think the first part you need to reckon with is, why is there a mistrust? And that mistrust is not going away anytime soon. So instead of trying to bulldoze past it and force things down people's throat, who rightfully don't trust healthcare systems, rightfully don't trust government or law enforcement, the military, why? And then stop doing those things that advance their mistrust. And I'm going to just say advance, that includes me. You know, I'm part of this system now, or at least I'm viewed as part of this system, and I have a mistrust. I think about this rush nationally and federally to come up with a COVID-19 vaccination. And I worry that how many corners are being cut by our national leadership to try to hurry up and get a win by like October before an election, right? And if you knew that, like, would you want to take that vaccine? Would you want to be the first ones to put that in your body, knowing that this was more of a political stunt than a public health stunt, a public health initiative? And so we've got to make sure that we communicate that these are humanity issues, and you matter and I matter, but that until I matter, all lives don't matter. And right now, I don't see where there is strong public health messaging that's culturally affirming. So that's where we need to start. We need to start recognizing and centering. Listen, this is why there's a mistrust. I know why there's a mistrust. Start having conversations with people. Start going to people where people are. And that's exactly what the Health Equity Leadership Task Force under my leadership has done. We're knocking on doors and doing it safely. We're partnering with local governments and faith leaders and nonprofit leaders to go into these neighborhoods that we have identified using census tract data and said, okay, who are these vulnerable communities? Why do people say at risk? What does that mean? Is that code for something? So I've operationally defined what vulnerable and at risk means. Because I'm not just going to suggest that these are all Black communities or Latino communities. Let's start centering our own bias right there. This is our definition. This is my team's definition. One or more comorbidities that make COVID-19 deadly. That's the start. Because that could be half of the people on this call. right? We know that the definition of who's vulnerable or who has a mistrust is widened so much because of this crisis. People who were once in the middle class are now unemployed and can't pay their mortgages. So this has really level set us. And I wonder, is that why we're having a real reckoning right now? Because this is impacting people who normally wouldn't have put themselves in the at-risk category. Wait a minute, how is it that I'm at risk now? I typically was in that middle class section, right? So one or more comorbidities that make COVID-19 deadly, annual income of 30,000 or less, and 4 or more people in a home that make social distancing impossible. That's how you operationally define who's at risk and who is vulnerable. Now we know where those at risk or vulnerable folks are. Now let's go to them. Let's come up with a plan. Let's make sure they have masks that they can not only reuse, but they have a nice quantity of masks to keep them and their family safe, that they have sanitizers that they can use on their counters and on their hands and on their doorknobs and light switches. Let's talk about if they're food insecure. Let's make sure they have health insurance so they can go to the doctor if they get a call that says they have COVID-19. What do if they don't have health insurance? So we're having those conversations. We're going to them. It's the only way. It's hard work. There's not an easy flip the switch. We got to trust. It's going to take work and time. And this is time that some people aren't willing to invest.
Thank you so much. How can we decrease anxiety and provide scientific evidence-based education regarding COVID in these vulnerable populations?
So that's a great question as well. As in addition to having conversations, we are utilizing technology a lot more, but we need to make sure that we're doing it and we're making it accessible to people with different abilities. I'm finding that all of us are on these go-to meetings and Zoom calls and Google Meets and Teams, and even our school systems are having a hard time. We've got to make sure that people with different abilities, such as those who have visual differences and auditory differences and consume information differently, that they can access some of these Zoom calls. But we need to have more of them, more town halls that keep people socially distanced and get accurate information to them. There's a lot of peddling and fear and misinformation. For example, swallowing bleach. How stupid is that? Everyone on this call knows that is just the dumbest thing ever. But it's out there, and there are people calling into 211 right now saying, well, if I just take a half a teaspoon and dilute it, it's no different, Dr. Underwood, than if I swallow a little bit of water from the pool. What if I just take a little bit of pool water? Right? Will that protect me from? These are real questions that are coming into us. So we've got to make sure we get that evidence-based science information out. We also need to start using all of our public radio stations, our television stations, billboards. We need to start pumping it out. All of our associations and civic organizations need to get on one accord and start saying the same things and come together as accomplices saying, listen, we want to be guided by science and not foolishness. Because see, here's the thing. I'm not running for political office. I'm gonna tell you the truth. I'm not trying to get your vote. I'm trying to save your life. And that's what we need to talk. That's how we need to talk.
Oh, thank you for that response. How is COVID affecting the Latino community in Virginia?
So thank you for that question. What we know from data is that the Latino community is overrepresented in the positive cases. And there are many families in mixed immigration statuses that make accessing health insurance and health care difficult, if not impossible. So we're hearing from many advisory groups like the Coalition for Virginia Immigrant Rights and LULAC and I'm talking with all these different organizations. In fact, they're part of the Health Equity Working Group stakeholders that advise and provide their input on all communication campaigns and a litany of other things. But what we're hearing is that they are overrepresented in positive cases, and in many cases are overrepresented as part of the essential workforce. So they're out putting their lives at risk, and then they're bringing it home to their families, many of which there are families of mixed, like I said, mixed immigration status. And so even if you get treatment for one person, there might be somebody else in the home that can't get that treatment. So the health equity leadership team thought it a good idea to hire someone officially to join our leadership team. Her name is Dr. Rebecca Vargas Jackson. She's in Northern Virginia. You can Google her, you can cyber stalk her and figure out who she is. Her name is, I'll say it again, Rebecca Vargas Jackson. And she has really helped. We've created a Latino community outreach program in Northern Virginia, Hampton Roads, and even Central Virginia. And so during the protests, we were going to protests, handing out masks and hand sanitizer and talking about being socially distant, but we were also reaching out to make sure all of our public information campaigns were culturally affirming and reaching these different communities, Latino communities that span, as you I'm sure know, on a continuum of different languages and cultures and dialects, and that also had their own misnomers of what COVID-19 was. And so making sure that we use radio stations that different communities listen to, for example, in Northern Virginia, where we saw a disproportionate impact for the Latino community. There have been calls for expanding Medicaid to the undocumented community. That's not something that I can speak on in terms of what the direction we're headed, but that is what we're hearing from those communities, that's what they need. And so, but one win I can share with you, as of July 1, legislation was passed that provides driver's licenses to the immigrant undocumented community. And so that is a win.
Yeah, sounds like a lot of interesting things happening there. What is the medical nursing community doing to address the fact that minorities are more vulnerable to COVID-19?
So that's a question I'm going to turn around on you all. You tell me what you're doing. You all are one of the stakeholders as part of that community. I'd like someone to turn their camera on and talk to us and say, how would you all answer that question? I don't know if someone else wants to answer that question, but while they're thinking, I will share with you that in the COVID-19 Unified Command, which is made up of the Virginia Department of Emergency Management and the Virginia Department of Health, under the leadership of Dr. Norm Oliver, the State Health Commissioner, under the leadership of Mr. Curtis Brown, the Director of the Virginia Department of Emergency Management, quick plug, first African-American to lead that public safety agency in Virginia's history. Report up to the cabinet, the governor's cabinet. And so given those two organizations or those state agencies who are running our unified command, there is many in the medical field who are providing input. So broadly and generally, we have the VHHA, we have different healthcare organizations and nonprofits, but we're also having conversations, obviously, with all the hospitals and all the long-term care facilities and a lot of the medical field or the community is at the table talking, like providing their input. And I don't mean just like state epidemiologists. I mean like people across the gamut in terms of the medical community. Now, to what extent, the reason why I turned the question back on you all, or I want to know to what extent this organization is part of any conversations broadly in the medical field, and how would you all answer that question?
Well, one thing is our Diversity, Equity, and Inclusion Council addresses a lot of different, we look at different information about COVID-19 and we discuss that amongst ourselves. And then what we're going to do is we're going to disseminate that information as we start gathering more data. And also I am on the COVID-19, the long-term care COVID-19 task force. And so I have information from there that can be disseminated as well. So is there anyone else that would like to share?
Hi, Dr. Underwood. My name is Jennifer Shepard. I am on the VNA board as the Commissioner of Healthcare of Workforce Issues. My question actually kind of loops into this area, which is about kind of backtracking a little bit related to diversity and equity and inclusion and what the VNA is being done. I think one of the things that I have a question about that maybe possibly you could share some insight as your role kind of evolves is, shouldn't we be kind of moving backwards in order to move forward a little bit related to as nursing and medical school education? The curricula, and I've been a nurse for over 20 years, so it's been a while, but the curricula has evolved to be a little bit more inclusive of identifying diversity issues and gaps in care related to healthcare disparities. However, shouldn't we be doing more and starting there first? Talk about those gaps, not specific to COVID, but because at the end of the day, if we already identify gaps in healthcare equity and access and risk factors, shouldn't we already, no matter what the pandemic or epidemic or the health issue becomes, shouldn't we be already able to forecast what those reactions and prevention should be?
So yes, I guess I'm confused because initially you said, should we move backwards? I'm not sure. And then to hear the latter part of your question, I guess the answer is yes. I mean, we already know these inequities and disparities exist no matter what the public health crisis is, because next year it could be something else, right? That shakes us to our core. And you have to be prepared for that, which is one of the reasons why, I'm pushing for the Health Equity Task Force to be codified in a permanent part of any future any future unified command structure whenever any governor declares a disaster or emergency declaration, to deal with this, but not only deal with it during crisis, but to deal with it in blue sky days, to say, okay, we know that there's a crisis, but the problem is, and this is a systemic problem for many people who are even on this call who call themselves allies in this work. The problem is that when it's not in your face, when it's not something that we have to deal with every day, it becomes okay to ignore it in plain sight. What I mean by that is there are many people included on this call in our neighborhoods, at our grocery stores, people we work with, people I work with, that are waiting for the news cycle to change so that we can return to ignoring white supremacy in plain sight, who are afraid to say the words white supremacy because it sparks fragility, who are afraid to talk about these issues because it makes people uncomfortable, or they think for some reason I'm blaming them for all of American slavery and racism, when that's actually not the case. So that the short answer is yes, we should. We need to reckon with these things. We already know that these things exist. What are we willing to do about them? We can't seem to agree on what to do about them.
Sure. Thank you for that. I appreciate that very much. I wanted to, and the work and moving forward that you've put in place related to the health equity kind of initiatives, I guess, for what you're moving forward with is kind of answers the question very well. I think my backwards comment was maybe not, the word backwards, maybe not the right word, but really starting at the beginning of healthcare education and in those that we teach to become practitioners, in giving them that education first, because we have so much to teach that I think that the diversity and racial inequities and talking about white supremacy and the influence and where our healthcare, our just healthcare in the United States happened, and what the core of that was, as you talked about earlier, is missing. And so it doesn't help us in then anticipating the needs of those that have those inequities. So I appreciate what you said before, and inclusive of the task force, and as from a health disparity perspective, in making sure that providers and the opinions and the expertise of what we do is part of that strategy. So thank you very much.
And also, I'll just underscore the fact that before the pandemic, there's also an entire work group, this is non-pandemic related, by the way, that is working with the Department of Health Professions to begin to reform what is being taught in our preparation programs. That I've been instrumental in pushing them a little more to be a little bit more robust in what's required in whether you're becoming a licensed BCBA or you're becoming a licensed nurse or a physician or dentist, no matter what you're doing in the healthcare, if you are licensed through the Department of Health Professions, that there needs to be some increased, I'll just say, beyond awareness, but education with regard to all the issues that you brought up on the front end as in their preparation program. So I agree with you. That goes for teachers and police officers and all public servants, to be honest with you. We see that across all fields, because this is a topic that everyone wants to ignore and nobody wants to talk about. And it takes special people to push this forward, because right now it's fashionable to talk about. However, no one wants to actually do anything about it, more generally or broadly.
So I would like to, there's a question in the chat that I would like to ask, because we are running out of time. What are 3 actionable items can Virginia nurses become involved with now with your organization?
So 3 action items. I love that question. Like, let's just get down to the nitty gritty. The first one that comes to mind is go to the governor's website right now. And I would ask you, charge all of you to sign up for all of his press releases, making sure that no matter what comes out of the governor's office, you're aware of it in advance, so that even stuff that you may not be interested in, such as 10 jobs were just created in the town of blah, 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 which might have nothing to do with you. But there is so much policy that's coming out and being made public that I think the general public is not aware of. So please sign up for those press releases. You can just go to Governor Ralph Northam's office and go to press. And you can just put your email in, they will come directly to whatever email you put in. Second, please sign up to serve on advisory boards, the governor's advisory boards and commissions. That's where your voice can be heard. And then the third one is, and actually that second one, you can go to the Secretary of the Commonwealth and you will see every Friday boards and commissions and appointments are made public if you get those press releases. I want some of you all who are on this call to be, your name to be on those press releases, because you've been invited to serve on the advisory board for X. You've been appointed to serve on the advisory board for Y, whatever is in your field of expertise. Because your voice is necessary. And then the third one is, please take a look at my website in particular and take a look at the One Virginia plan and see how that is applicable to your organization here, and even broadly to where you work or where you worship, because we are One Virginia, and it's not just for state agencies, it's applicable for all organizations, civic organizations, for-profit companies, houses of worship, universities, museums. So take a look at the One Virginia plan and see how you can apply it to your spheres of influence. Thank you for the question.
When, I think it means, when are we going to restore the unallocated funding to the programs that are in place specifically for those communities you mentioned impacted by COVID disproportionately? Many of the services they depend on for day-to-day surviving and thriving have lost funding for 2021, 2022 CSBs, public health funding for new parents, infants, and toddlers, brain injury services, etc.
Thank you for that question. So before the pandemic, we were the #1 state to do business in. We had the resources to do so much more. And as you know, these are COVID-19 pandemic times that have made our budget even all the more tight. These are not easy decisions, and they're decisions that you cut one thing or you fund one thing, it cuts something else. And so the General Assembly is reckoning with that budget right now. And all I can say is, as an organization, as an association, I suggest if there's specific things that you want to fight for and that a lot of us are fighting for, continue to make your voices heard to the administration and to your local elected officials.
I was just going to share the other question that Melissa had posed. 211 funding was unallocated for 2021, 2022, and it's the largest single collection of social services resources. Does your office have a plan to help restore that funding?
Those are not, the 211 of funding that you're referring to does not include my office. That's not under my jurisdiction.
Great, thank you. We'll pursue that separately.
Thank you so much. Well, for the sake of time, I would like to thank you for facilitating today's conversation. And thank you so much for being with us today to share how COVID-19 is impacting vulnerable populations across the Commonwealth, and to discuss how we can support these populations and provide equitable care to all. This has been an excellent discussion, and I will have Janet.
Yes. Vivian, I want to thank you for facilitating today's conversation. And Dr. Underwood, thank you so much for being with us and sharing how COVID is impacting vulnerable populations across the Commonwealth. It truly was very thought-provoking and an excellent discussion. I really appreciate it. I think we all do. And I did want to offer a reminder to everyone that we will post the recording of this webinar on both our COVID-19 resources page and on our on-demand library at virginianurses.com. So thank you everyone for joining us today. Have a great day.